Now we're going to be talking about the health of your smile. An imperfect smile can be a thing of the past. And this is all thanks to mini dental implants. Here to fill us in, we have Dr. Andrea Joy Smith herself. And always great to have you here on the show. You, my friend, are incredibly passionate about mini dental implants.
Yes, I am. And the reason for that is I'm particularly inspired by my patients' unique problems that they face. 11 years ago, for instance, my dental implant patients were perplexed. They were either told that they had enough bone for implant treatment, however, the cost was prohibitive, or they were told that the cost wasn't a factor, but they didn't have enough bone, and they would have to undergo some extensive procedures in order to receive dental implants. And many dental implants can solve the problem for both of those types of patients.
Okay, so for those that are watching for the first time, or this is a new concept to them, explain to them what is a mini dental implant and really highlight the benefits of it.
Sure. Well, many dental implants, like conventional implants, are sort of small titanium screws that are inserted into the jawbone, and they could be either used to support a full denture in place that'll snap into place, or they could be used for one single tooth.
Okay, and how long has this been around?
Well, implants in general have been around prolifically since the 1980s, I believe, when it was actually discovered by this Dr. Brandenmark that bone actually fuses to titanium. Many dental implants prior to that were used in the early 60s for some temporary procedures. But after that discovery by Dr. Brandenmark, dental implants became in widespread use, and for the last 20 years, many dental implants have been used as well.
Okay, and in what type of situation would mini dental implants be a great benefit for somebody?
Yeah, they're beneficial because, as we like to say, they're 5 times less. They're less invasive, they're less costly, there's less surgery, there's less pain, and there's less healing time. And so if they find themselves in a situation where they have enough bone for a mini dental implant, but maybe not enough for a conventional implant, that mini dental implant can sort of fill that gap and give them an option that they didn't have before.
And let's talk about your office. What makes your office unique opposed to those that offer a very similar process?
Sure. In my office, I offer primarily mini dental implants, but I do some conventional size implantology as well. But anywhere in Sacramento, patients can receive conventional size implants. But if they find themselves in a situation where they don't have enough bone or their particular problem can't be solved, then the mini dental implant that's offered in my office, it can usually fit that goal. And so I've probably placed over 7,000 implants. I'm a diplomat in the International Academy of Mini Dental Implants, and so I'm considered an expert. And I've probably done more mini implants in Sacramento than any other office in Sacramento.
Well, I certainly would feel very comfortable with you doing a mini dental implant, I'll tell you that, with that kind of experience and background. So let's talk, though, about the experience. What can someone expect when they come to your office and they're interested in this?
Sure. When they come to my office, we'll first do a consultation because we need to figure out whether they are a candidate. We need to look very closely at the bone that's available. So we do a cone beam computerized tomography scan or a CT scan, and that lets me know the width of bone that I'm dealing with and the height of bone that I'm dealing with. And it also allows me to avoid any vital structures like the nerves or the sinuses when we're placing implants.
Okay, and let's talk about the procedure itself, too. Kind of walk us a little bit through that.
Sure. When they come to my office, after we've made the proper diagnosis, we're basically numbed up. And rather than doing a larger surgery to make a large size space for the implant, it's usually a pilot drill. I hate to say drill on TV, but it's usually a pilot size opening, and the implant is only about twice the size of the pilot, and so it will easily insert with my handpiece into place.
And I know we have some before and afters too.
Yes, we do.
Let's go ahead and take a look at this.
Yeah, this young lady actually was brought in by her grandmother. Her grandmother just wanted to see her granddaughter smile again. And even before we got to the stage of putting on the implants, we did some try-in visits to make sure that we were maintaining her bite and putting the teeth in the right position. And this is her after. She smiles all the time. I saw her in the office not too long ago, and that was probably about 5 years ago when we completed that procedure.
Wow.
This young lady actually wore an upper denture for a very long time and wanted to have the lower teeth done. However, she didn't like her upper denture. And so after she heard about mini dental implants, she decided to have both fixed restorations done for both the top and the bottom. And so that is her after.
That looks absolutely fantastic as well.
And this gentleman was on the way to dinner with his wife and some friends. And his wife was very adamant about him having that tooth fixed before they went.
Yeah.
So they came in the same day. It was less than an hour and a half procedure. And he walked out with a temporary tooth that day, and they were able to go out and enjoy dinner and not be embarrassed by a smile with a missing tooth.
Wow. Okay, so you can do a whole set. You can also do the individual, as we were talking about.
Yes, we can.
Okay, and I know we also have a video too that kind of also helps explain the process. So can you walk us through this?
Sure. There are a lot of patients that are missing back teeth. In fact, the first molar, which is the one that's being replaced in this video here, is the most common tooth that's missing from most patients. And with a few mini dental implants in that location, we can put a crown on, and they'll be back to chewing normal in no time.
Wow. Okay.
Sure.
Very impressive. And I know we actually have a couple models right here too.
Sure. I'd like to go over maybe this one. The lower denture that patients have for years is usually the most difficult one to wear because our tongue is constantly moving, and when we talk, only the lower jawbone moves. And so with these mini dental implants being inserted into the jaw, so that, and the housings or the receptors for the implants being inserted into the denture, that denture can snap right into place.
Wow.
You hear that snap?
I did.
And it doesn't move, and they no longer have to use denture adhesives and things of that nature.
Wow.
Yeah.
What a beautiful fix. Okay, doctor, if people are interested, where do they go for more information?
Of course, they can call my office at 916-482-8300. You can see my website at smileagainnow.com. And on Instagram, you can see a lot of little videos about the implant treatment that I do, and that'll give you some information to contact us as well.
That's a great way to kind of introduce yourself to the process and start to kind of wrap your mind around it. So many incredible options. Thank you so much.
Thank you, Melissa, for having me again. I appreciate it.
This interview involves commercial content. The products and services featured appear as paid advertising.